Burns is a painful disease, emotionally and physically. The treatment is painful, the follow-up is painful, the response from society is painful. So these survivors, unlike someone with a terminal illness, they don't die, they actually live. But you can't see them because they can't come out. Society will not accept them.
Few realize the scope and impact of disabling burn injuries. But every 5 seconds, someone is severely burned in a developing country. Compounding the large scope is the fact that proper burn treatment is almost non-existent for the world's poor. But one woman in Sri Lanka is out to change that. Dr. Chandini Pereira is helping burn survivors have a second chance at life.
Any given time, an average of severe burn, and we mean severe burn by over 20% burn, which can go into shock within 24 hours, any perineal burn.
Untreated burn wounds become disabilities that most can't even imagine. Heads fused to necks, unmoving. Fingers stuck together, useless. Legs contracted and bent that prevent walking.
Someone who can't feed themselves or wash themselves after they go to the toilet. Really, what is that pain? And there's another cultural thing, you know. When in our part of the world, when a woman is pregnant, you really want to look at only beautiful things. So if you're burnt, deformed, and being poorly treated, you can't even go to a clinic, a maternity clinic, because other women cannot look upon you, you know. They'll have ugly babies. It is difficult for me to get some of these women to be seen in the maternal clinic of our own hospital. That's how stigmatized deformity in burns is. And yet no one does anything about it because it takes a lot of hard work and psychological help as well to get them to the stage where they want to help themselves.
Severe burns happen frequently because 1/3 of the world still uses open fires for cooking, heating, and lighting. Overcrowded living conditions and lack of safety measures are other factors. But violence against women, throwing acid or setting them on fire, and even self-immolation are tragically the reasons for most burns in Dr. Pereira's unit. In fact, they're on a rise in Sri Lanka.
Kumari is really the classic case of domestic violence in our country. A young, attractive girl gets married to a man who is an alcoholic and kind of puts through with it because, you know, it's almost like in our culture, in a way, getting beaten by a man is sort of seen as quite acceptable. Really, because you don't talk about domestic violence. We don't. Physical abuse, that's bad. And Kumari's husband was at it. So she already had 2 children. And I suspect when she set herself on fire, it was the classic case of, you know, coming back, abuse her, drunk, abuse her, marital rape. And, you know, then you end up with this child and you really don't want any of it. So she came to me stuck. Her neck was stuck, her arms were stuck, her chin was stuck, and she was 5 months pregnant. And she did not want her baby. But the baby survived. And Kumari wanted the baby after I released her neck. She wanted the baby. That's amazing because she can barely feed herself. They're so poor. She has 2 other children to feed, but you know, the whole family came together. And her sisters who have children of their own, they're looking after the baby for her. So Kumari has survived and she wants to live. She wants the baby. The baby now really gives her a reason to live. But there's a long way to go for her to be empowered. But just the fact that she's coming to clinic, you know, wanting to get things done, I think she's going to make it. She's going to be one of my survivors, one of my postcards from heaven.
Treating burns is the stepchild of the plastic surgery community. Few want to do it, and in the beginning, even Chandini resisted.
Plastic surgeons are supposed to do facelifts and tummy tucks and drive BMWs. And so, no, I didn't have a golden moment when I thought, this is what I'm going to be doing all the days of my life.
After her residency, Chandini took a rotation in burns, and soon she found herself the accidental director of a small, neglected burn unit. The needs were overwhelming, the work exhausting. She wanted to quit, but she knew she could make a far greater difference transforming the lives of burn victims than providing cosmetic surgery for only the richest of her country. Her motivation is her patients, her postcards from heaven.
A really good clinic day for me, a day in which I feel buoyant and happy, is when a patient comes to me who has been this depressive, severe burn, comes to me dressed well to my clinic, and I ask her, how are you doing? And she says, fine, ma'am. My kids are going to school now. I have started a little business. Did you know I did that and did this? And they've given me something more than I've given them.
She began to notice that the majority of the severe burns recorded as accidental were not only happening mostly to women, but the burns followed a specific pattern. When she spent the time to get to know these women, they confided that they had set fire to themselves.
It's prevalent in Afghanistan, in Iraq, in certain parts of Africa, and certain parts of Vietnam as well. But it's not something people talk about in Sri Lankan culture.
It was Chandini's respect and the rapport she had with her patients that allowed them to open up.
The intent is not to die. The intent is to draw some attention. They want acknowledgement. That's what they want. They're not saying, love me forever. They've gone beyond that. They're like 3 children and they're working their butt off.
Chandini told me that nearly 70% of her severe burn patients are the result of self-immolation. 25% are accidental, and around 5% are what she called homicidal acid attack victims.
Yes, Kanchana was a very beautiful girl, very bright, and a first-year nursing student when her acid throw happened. She was actually on her way to the nurses training school, which is very close to the hospital. And she recognized someone come at her. Maybe it was a jealous boyfriend to whom she has refused the advances in her village. She's beautiful, so everyone wants her. It's almost a curse. Most of my victims, acid burn victims, are very beautiful women.
Just after my accident, both eyes was damaged, and my whole lifetime I have to continue with these eye drops. If a person face such like thing, they become socially isolated and they are mentally collapse. But I don't want to become like that way. I want to face my society and I want to get back to normal. I want to look after my parents and I want to help them also to forget that past, because whenever they see in me, they just go their past. They are suffering and they are crying in their mind.
And Kanchana is a successful story. She's gone out with her burns. Everyone in the hospital knows Kanchana because she was really bright. She became 11th in the whole island, and that for 30,000 nurses. And she did it despite many odds, many surgeries, lack of hair, scarring, wearing a mask. And so Kanchana is difficult to hide. She's an empowered woman.
Chandini said that the men who attack their victims with acid typically are only fined $5. She has fought tirelessly for victims' rights and has had the courage to uncover and bring to attention domestic violence, which is a very taboo subject in her culture. And all the while building, almost from scratch, the most successful burn center in Sri Lanka. She almost seems surprised that she's accomplished all this.
I had no idea. Because as I told you, I'm not a very noble person. I love reading Vogue and Elle. I like looking at Donna Karan and doing burns does not bring me money. And the whole thing about plastic surgery is now about making money. And that is a conflict too, because I like the good things in life. I question myself sometimes about what is this I'm doing? Then God sends me a postcard from heaven. It's a lot of my women whom I treat for self-immolation. They actually become very empowered. I have been a little part of that change. And that gives me something I can't buy.